In Pakistan, there is generally a very low level of awareness on osteoporosis. And despite major advances in osteoporosis diagnosis and treatment, low rates of investigation and treatment of patients with osteoporotic fragility fractures are reported. There is no government policy, and osteoporosis is not considered a major public health issue in Pakistan and is not part of National Action Plan. Available data on osteoporosis and fragility fractures demonstrate a very high prevalence in Pakistan. The incidence rate range from 5.6 to 17.6% in premenopausal female to approximately 20 to 49.3% in postmenopausal female. Major barriers to identification and treatment of osteoporosis in Pakistan is a lack of clarity regarding who is charged with the responsibility of undertaking care of osteoporosis. Then there is time and cost of resources, medication use, and cost of treatment. Also, there are minimal diagnostic facilities and limited number of DEXA machines available, and they are available only in large towns and cities. Secondary fracture prevention is the first step in developing systemic approaches to improve screening, diagnosis, and management of osteoporosis. Identification of individuals who are at high risk of sustaining fragility fractures and treating them in accordance with the best practice guidelines is needed. And this can be achieved by promoting a coordinated care model of fracture liaison service at an institutional level. Osteoporosis needs to be included in the National Action Plan for non-communicable diseases so that efforts can be directed towards initiating development of country and regional database for fractures and for screening of high-risk individuals who are susceptible of sustaining a fragility fracture. Once we have this system in place, then efforts can be directed towards improving nutrition and lifestyle factors. Another important consideration is to address rampant vitamin D deficiency in Pakistan and suboptimal calcium intake, and we need to promote and implement a food fortification policy for Pakistan. The Asia Pacific Consortium on Osteoporosis comprises key medical opinion leaders from several countries across Asia Pacific region, charged with developing tangible solutions to substantive challenges involving osteoporosis management and fracture prevention. APCO's mission is to engage with relevant stakeholders, which include healthcare providers, the policy makers, and the public to implement country and region-specific programs for prevention and management of osteoporosis and its complication of fragility fractures in Asia Pacific region. The APCO Framework is the first pan-Asia Pacific clinical practice guidelines for screening, diagnosis, and management of osteoporosis, published in Osteoporosis International in January 2021. This set of clear, concise clinical standards will support national societies and guidelines development authorities and other healthcare policy makers to develop new guidelines or to encourage revision of existing guidelines. Implementation of the framework in Pakistan and development of national guidelines on osteoporosis management will significantly help the physician to improve and manage osteoporosis care. By rallying national societies, guidelines developing authorities, and healthcare policy makers, we can collectively advocate to utilize APCO framework for development of national osteoporosis guidelines in Pakistan.